This time, in our community, only 1 in 5 children who need mental health services receive them. David Coon wants to introduce you to the challenges we are facing in our community, the people that are working to solve these challenges, and what we can do to support them. Because if we, as a community, don't help each other, then who will? Here's the problem. Only 1 in 5 youth who needs mental health services receive them, and almost all mental health problems begin before the age of 24. The consequence is that mental health problems are costing the Canadian economy $50 billion annually, and more importantly, millions of Canadians will struggle with mental illness for the rest of their lives with little or no support. So what's the holdup? It comes down to funding. The Canadian Mental Health Association is urging provincial governments to spend at least 9% of their health budgets on mental health services. The national average currently sits at 7%. But in New Brunswick, we spend less than 4% of our health budget on mental health services.
Because there is a general underfunding of mental health services, it does impact people's ability to access services. The services try to get those with the highest risk in as soon as they can, but there are many people that can wait a long time, and that varies from area to area, but some people can wait a year or more at times. Think of a depressed person. Someone already feels depressed, and then they start doing poorly at school, so there's pressure of not doing well academically, and then their friends aren't around them because they're withdrawing from them, so they don't have as much support, and maybe their family doesn't completely understand, or they're becoming overwhelmed with what's going on, and so they start to feel more and more isolated. So you can see how over time that can get worse and worse, and that the burdens on that person get heavier and heavier. If you drop out of school because you can't manage it, if you are unemployed for lengthy periods of time because you can't manage it, that damages your future quite a bit. You then have a resume that has nothing on it. That makes it very difficult for you to engage down the road. If it affects all your relationships and you no longer have anyone around you supporting you, it becomes a very lonely place to be. And people, unfortunately, with untreated mental illness can run into all kinds of problems in society as well. Sometimes they become in conflict with the law. They become involved in substance use, which leads to other problems. Like I mentioned, academic difficulties. So it can have a significant impact on people and their future. There are parts of the system that work really well. There are many dedicated mental health professionals that work very hard every day and work in a very collaborative way with each other to deliver great services to the people that can access it. It's the wait time, and it's because there are only so many doctors and there are only so many clinicians and they can only see so many people. My favorite part of the job is being able to be there with people in some of their hardest times, because it's often very difficult for people to talk about mental illness and the struggles that they go through, and some of the stories are very personal. But they're stories that they need to share with someone. They need to be able to let it out to someone. And so to be able to be there with them in those moments, to be a safe space for them to share what they're going through, and then to follow them through their journey is very rewarding. It's very rewarding. It is great when we are able to get to someone in their time of need and we see them recover. I can think of someone recently who's struggled with severe anxiety for many, many years. Never gave up in it, continued to work hard, but wasn't making a lot of progress. Continued on and kept struggling, especially with suicidal thoughts, kind of constantly bombarded with those ideas and trying to continue on with her life despite that. But recently, we were able to try a new medication for her, and it's had a profound effect. We kind of tried it as a last chance sort of effort, but she has turned things around amazingly. Her friends say they can't believe the difference they see in her. She's working full time. She's out in the community socializing, and it's wonderful. And it's, I tell her I'm very excited to see what will happen for her now. I'm excited to see where she goes at this point. If we have more funding, we can help more people to have these types of recoveries and get back to their life.
We can support mental health professionals in our community by reaching out to our local MLAs and asking our province to increase funding for mental health services. We can also contact the minister responsible for health specifically to make sure he knows how important this is to us.